For this first video, I'm going to be doing an examination of a patient that I suspect would have some sort of carpal tunnel syndrome. So with palpation, I really just want to worry about the palmar side because the median nerve runs through the palmar side, so we don't really need to worry about dorsal palpation. But I can just palpate for the major bones of the wrist, so the scaphoid and the lunate, especially because that's where the carpal tunnel runs over. And I'll check for any pain with reproduction of symptoms. That hurt right there?
A little bit.
Okay. And also I would be observing the thenar eminence because as the radial nerve innervates the thenar eminence muscles, except for one, the ulnar nerve, if it's too severe of a case, then I might see some atrophy in that thenar eminence compared to the hypothenar eminence. Range of motions, I could do wrist flexion, so just bring that wrist up. Good, bring it back down. Bring your side in, bring it out, just checking for radial and ulnar deviation. And then I can do some finger flexion, especially finger flexion looking at the first 3 digits as the median nerve is what innervates these 3 nerves. And then some joint mobilities, I could just do some passive, I could just do some PAs, check for extension, do some APs, check for flexion, do some medians, medial glides for ulnar deviation, and radial glides or lateral glides for radial deviation. Special tests I can do to rule in or rule out carpal tunnel. The first is the Phelan's test, the Tinel's test. The Tinel's test, where essentially I find the carpal tunnel. So going a little bit and then going a little bit proximally, I just tap on that nerve and ask for any irritation of symptoms. Okay. And then the other test is the compression test, where I would add a compression force on the carpal tunnel and then flex the wrist up, checking for any provocation of symptoms. Anything? Okay. And that's a pretty basic examination I would do for a patient with suspected carpal tunnel.